guys. You all are highly welcome. Get in here, get in here, get in here. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Yes, that's me. You all are highly welcome. Guys, it is a very beautiful day today. I am happy to be amongst you today because this topic we are discussing is a very delicate topic. So while you are here, guys, click that share button so that you will get everybody in. Because when I came across this topic yesterday, I was like, oh my goodness, I need to talk about this because as a doctor practicing in Nigeria and now relocated in the US, I have seen something similar to this, but not exactly this. You guys will be so excited that you join me today. So, while I am trying to bring in people so that we have a very robust discussion, number, you too should also share. Guys, this topic is so very important to all of us because when I saw that video yesterday, I was like, oh my goodness, how did I just even miss this particular girl? Actually, I've been seeing her pop into my timeline, both on Facebook and Instagram and other social media network. One of the things I really admire about her is her boldness, okay, to come into the internet. But I guess one of the reasons that made Queen Bola to come out is because of the trauma, the traumatization and the stigma that she has faced for the longest time. Can you imagine how she has been abused by men and women just because of how God created her? So with that being said, you all are highly welcome on my page. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Yes, that's me. You all are highly welcome to my life. Today, we are talking through hemophroditism. Hemophrodite, okay? What is this hemophrodite? This is a very rare condition where you see a person, a human being like me and you, have the same sexual reproductive organ of both a man and a woman. You heard me right. You have the gonads of a woman, you now also have the gonads of a man, all in one. Can you imagine how that will feel on a human being? That is what Queen Bola is feeling. So when I came across that video yesterday, I was like, no, I'm going to actually come online because my platform is the platform where I create awareness, okay? There are so many things that doctors, you all saw the doctor that came in and presented mental health, right? She discussed mental health, that all of you that got that video in your timeline saw what people can face when they have mental health. So this particular hemophroditism can give somebody mental health. Come on, just check it out. If you, as a human being, fall in love with a man, and then suddenly that man had already heard that you are both man and woman. For you, you didn't know, and you just fell in love with this person, and the person convinced you to snap picture on the internet. This is Gen Z period. During the time we were growing up, we didn't have a lot of computers. We had computers, but it is just here and there. You have to go to business center to do that. So a lot of people will not have that ability to expose themselves and show off themselves online. But now, young people use social media for different kind of things. So One of the stories that touched me is when she said, when she fall in love with somebody or start talking with the person would like, okay, show me your body, I want to see. And, they start doing their sex stuff, all right? While they are doing that, this person will snap her or tell her to do a video and send to them. Being that she has started falling in love, she is going to send that video without having any bad feelings or anything that the person is going to do to her. But guess what? This person goes on to blackmail her. And in my last video, some time ago, I have also talked about blackmail and the kind of things that you're going to do. Never you yield to a blackmailer. If the person wants to post your video, let the person post your video. One thing you should understand is the discussion about you and your sex tape is going to go away after 6 months. Or you can call the police on the person. Don't you, because when you start giving money, and that is what happened to her. So let us go and dive into hemophrodite. Now, have you shared this video? If you have not, you have to share it so that other people will also learn, because it is very, very important that while you are learning, you are also sharing this so that another person will learn, because you never know. It could be you or your child or your descendant of any sort could be that person that will make a mistake and marry somebody or have a relationship with somebody that is a hemophrodite, or your lineage, if it is hereditary in your lineage, the person could actually get this abnormally. And are you going to tell me that the person is going to just be in the dungeon and just be there and by himself? No. That is why, for me, when people say, when people talk about having miracles, okay, I take medicine to be a very big miracle. You know why? With medicine, if you identify this child, a baby that is born that have two gonads, that is the female gonad and the male gonad, you can do a definitive surgery, correct that anomaly at that time that this baby is still young, by making sure that you, first of all, identify the sex organ that is really very active in this particular baby. But you must do it with the parents' consent, and you take them along with you while you do the corrective surgery. Okay? For Queen Bola, this particular girl that came online, I've been seeing her pictures, and I'm sure if you have seen Queen Bola's picture, videos flying around in all social media, comment on the comment section. Let me hear you. Because this particular video, when they did that interview for her, I felt her pain. Now, remember, before I go into a discussion, I always use what I have seen first class information as a medical doctor. I have sat down, gone for a word round and seen this. I'm going to tell you this story. Okay, just listen. Then we'll dive into hemophroditism. I was a young doctor doing my house job in Lasut. I was in urology department, okay? When you go to Lasut, urology department is a department that you don't want to be in. You know why you don't want to be in urology department? We are 100% ready. The day we are doing catheter removal and putting in the catheter back for people that have problem with their urination, for male, I'm talking about male, okay, because urology is more of male. We will start from 8 o'clock, and by 6:30 p.m., there are still lines of people. We have to sometimes postpone we have to sometimes postpone it. You know why we're postponing it? We are human beings. We are somehow also tired. We are doctors. We are not robots. How can a human being, you are a health officer, you are going to be changing catheter for people that have one form of urinary problem or the other for a whole entire day? Okay, so now that day we wanted to go and do ward run. That's the day for our ward run. So our chief consultant came. we were seeing other patients. We finished seeing the people that, they did surgery on, those that they did orchidectomy and all that and all that. There was also a man, probably one day I'm going to also talk about that, where he had a scrotal swelling that, he went to TBAs and all, he went to all these herbal people, and they messed the whole entire thing for him. So his scrotum got busted, okay? That's another day for another story. But anyway, before we were going, seeing all these patients. Then there's one particular room. Before we entered that room, the doctor stopped. Our consultant stopped and said, look, you guys, you really need to understand this case before we enter in. This particular she is already agitated and withdrawn. She doesn't want to see anybody. That's why we put her or him in this particular room. For me, it is a him. This one is a classical he. But what happened is that the person that did that surgery, the person that did that delivery and birth, probably is not a medical personnel, might not even be a midwife. And they saw something that looked like a clitoris and just took it that this person is a female, okay? So we went in there and we saw a young, because he was facing the wall, like I said, he was withdrawn. He didn't want to see anybody, life was somehow frustrating for him. So when we came in, of course, we already have the little knowledge of the case we are going to see. But immediately you go in, you will see that he is classically a male person. Okay, he is classically male. He had this broad shoulder. He had this male physique. So when he turned to us and greeted us, and the doctor was like, how are you doing? He said, fine, and all that. So the doctor now started telling us the story. This young man, the parents had all boys, right? And they wanted a girl. They had like up to 6, I can't remember now, it's been long. So it had about 6 or so boys. So they wanted a girl. So when she got pregnant for this baby, she carried this baby till term and delivered this baby. When delivered the baby, they obviously didn't examine. But also, I am also worried because as a mother, I have a girl child and a boy child, right? When they were young, you were cleaning them up. So definitely you are going to be cleaning their reproductive area, right? So how come the parents missed that they didn't see any pink coloration? Okay? They didn't see anything pink. They didn't see anything labia majora or minora, because that woman is also have this genital, areas and organs on her. So if you are cleaning your child pooed and or weed, and you want to clean either the diaper, those days maybe what they were using is napkin or even wrapper. In Africa, things were so difficult, so some people don't even have the money to buy. Anyway, there wasn't even a diaper at that time. By the time this boy was delivered, if there was diaper, I'm sure it wasn't in Africa at that time, because I did my house job like maybe 10 to, what am I talking about? I did my house job 19 to 20 years ago, okay? Yeah, so I'm an old doctor, so you all know. So I am still till today wondering how the mother didn't pick that situation and, find solution to it. But anyway, they continued rearing this she at that time, because they took her to be a she, because they just saw something that looked like a small thing. According to the mother said she thought that it was a vagina, okay? And clitoris, labia majora, labia minora that she saw. So when they started training this child, when you are a young girl, there's no differentiation between a man and a woman. The differentiation comes at pubertal age. When you start getting to that your puberty, that is where the characteristics of a female and a male is going to come out. So the male are going to have baritone voice, deepened voice, mustache, and male physique, broad shoulder, male reproductive organ. Whereas the female is going to start having the tinea breast development, okay? Tinea 1, tinea 2, until they get to the full, time that their breast is going to really come out. And they are going to start having the feminine physique, okay? And then their buttocks are going to be a little bit wider than that of a man, what we call gynecoid pelvis. Why the man's pelvis and buttocks is going to be the shape of a male, that is android pelvis. All right, so this particular young man was red, so she was playing with female and believed that she was female because the parents were always dressing him with a female clothing and all that. But when the sex hormones, menarche set in, God and nature did their work, and he tilted to be a man. He started having a deepening of the voice and all that, and his peers, friends, girlfriends are all surprised, like, oh wow, you were a girl, what is happening? Guess what? Our bad African belief, they told this woman that it is the gods. They offended the gods, and the gods changed their female child to be a male. So all this while, during that pubertal age, puberty comes, some people, it can come as early as even 7. I have seen somebody that had puberty at age of 6. So pubertal age is normally between 8 to 12 or 14 years. During that time, she was busy going from one herbal place to the other, from one ancestral spirit to the other, trying to find out what she did. And they had already spent so much money, and they were just wasting their time. And by the time they came to us, the boy was already either between 16 and 18 years. So what it means is that he has fully developed the male sex characteristics. Okay, he had BS, he had the Adam's apple, male sexual, he is already a male. I'm sorry. So if this fan is disturbing you, can you comment on the comment section so that we'll be able to adjust, okay? So guess what happened? Unfortunately, they came to us, and examination was done, and we told the woman that your child is a male. And we told them what happened. That person that delivered this baby did not examine this baby. They just saw something because the parents were wishing to have a boy, a girl. They just saw that male phallus, okay? That was supposed to be the pineal, the mouth of the penis. So, because it was still small, probably this child had undescended testes, okay? So what they would have done is take the child to hospital, and the doctors will do what they need to do. And they will just anchor the testes, and this child will still grow as a boy that he is. But because the parents already want a baby girl, when this baby was delivered, all they were hearing from the nurse that delivered the baby is, oh, congratulations, you have a baby girl. And they went home and raised the girl as a girl. But meanwhile, genetically, this child is a male. So when I saw Queen Bola's interview, and I said, no, this is my time, because I had wanted to do it, but what I usually don't do is I don't pick a topic in the internet without the person coming out. That's why I didn't discuss MC Baccarat's child's birth asphyxia. Okay, I made sure I didn't discuss it until they came out and told their truth, and I had to make that video about birth asphyxia and told you what happened to this family. Whereas internet trolls were trolling them and saying that they are they use their child to do ritual. Okay, So back to what I am telling you right now. Let's go to what true hemophroditism is. Okay, now this is a sexually reproductive organ of a person, one individual. Your sexual reproductive organ is that of a male and a female. That means you have male gametes and female gametes together in an individual. Okay, and this person may have the following characteristics. The person will have probably male body, but under him, he has the vagina, he has the labia majora and minora, and even an opening. May, even when they do the scan and other things that they're going to do, the person may have uterus and fallopian tubes. And at the same time, will have the penis, still have the two um, 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 sacs by the side of the penis. So what it means is this person can either even get pregnant if actually he, let's call him he, have intercourse with a man, especially if the female reproductive organ is fully developed. So in that case, we have 46XX, we have 45XO, 45XY. That is mosaicism. Okay? So looking at Queen Bola, she has a full-blown penis and she also have a vagina, because like she said, she can pass urine from the female side of her clitoris and can also pass urine on the bola, that is the penis. Okay, so can you imagine, while she was growing up as a child, she didn't know what was happening to her. She was physically looking like a female, so she was playing with fellow females and believing that she is a female. And then, like she also said in that video, she said one day she wanted to wee wee. In Africa, it's not like abroad, right, where you have toilet for female, toilet for male, and all that. No, in Africa, schools, general public schools, majorly don't even have restrooms. So these children will go outside to urinate. So she had gone with her girlfriends to urinate, and she was standing to urinate. A woman is not supposed to stand, though. When you start getting older, I know a lot of elderly women that just stand and urinate, but a woman is known to squat to urinate, right? So they saw that her urine was going straight, and she was urinating like a male. That was where her first, kind of embarrassment came. Her friends talked about her, molested, not like molested her, but started discussing about her. So that's when she said she decided to be open about it. But she didn't still get open about it because she was still hiding herself. But what made her, that broke the jinx for her to say, you know what, let everybody know about it. I am what I am. There's nothing I can do about it. It's when the male people that have seen her physique, she's a pretty woman. You guys should go look for her. Her Instagram or Facebook name is Queen Bola. Okay, she is, for me, she is the best person in the internet, because for bringing out this kind of story, for people to understand that there are some people that God created in a unique, different way from all of us. This is a teaching kind of person that God has brought to the internet for people to understand, even though she is actually not doing it in such a way to teach people, but she is actually living her life on the Instagram, Facebook, and every other social media. Okay, all right. So she said when males come to her, all they are coming for is probably they have heard about her, somebody have told about her, and then they will come and make it look like, yes, they love her, they want to be with her, and she will loosen up and start having sexual feelings and start falling in love with this man. And what do they do to her? They will end up either sleeping with her. After they have slept with her, they will take pictures of her and start blackmailing her. So the particular one that touched her is when somebody told her that, oh, she saw this person in Facebook, and the person told her that, look, if I love you, I am interested in you. Can you show me yourself so that we start knowing ourselves? I don't care. I don't judge people from who they are. And she actually gave in. And this man promised her that she's going to give her a lot of money. Promised her to give her $20. To her, she felt that $20 was too much money. But when this man got the pictures, the man now turned it on her and insisted that she give him the $20. But she said she doesn't have the money. And the man was threatening to post her videos. So she said her friends told her that, look, you can't pay. You can't pay this man. Let him post this video. So that is why she now decided and said, I have had a lot of heartache. I am a female. I want to be a female, to be loved by a man. But all the people that are coming my way are breaking my heart. So the best thing for her is to have a female friend. Now, her female friends, of course, she is having bola. And her bola is walking like a normal bola. You heard me. She can have the sex, reach orgasm by releasing. So that's why she was able to impregnate her girlfriends. According to her, she has a male from the first girlfriend she had, and she wanted to marry this girl. She wanted them to be together, but the parents of the girl refused. So between her and this girl, they know that, oh, I am the father of this child, but let us hide it so that the world will not know. She now developed another relationship. This time around, she gave birth to another Hemophrodite, because to her, she is saying she gave birth to a girl, but this girl is also, the baby that she had is also having bola and Becus. So what are we going to do? The solution to this particular baby, so that she doesn't face the trauma that this young Queen Bola is facing. You guys don't understand the trauma this girl is facing. When they asked her, she said, yes, multiple times she has thought about committing suicide. She has thought about, ending it all. You all don't understand how this had really caused a lot of mental health for her, and it's making her to look like, I am a different person. What is this? Why am I like this? Okay? So now, how do you do this gender reassignment? Okay? Now, there is this examination that every person that delivers a baby, be it at home, in the hospital, or in the theater, you must examine the child. This neonate that just was delivered must be examined. You are going to examine the vagina, reproductive organ. Let's just put it like that. What are you examining? Number one, there are some children that can be born with their testes not descending. So for this particular boy I told you we saw when I was doing house job, his testes did not descend. So that was why they looked at his reproductive organ and felt that, oh, this is a girl. Okay? So what are we going to do? There is this rule of thumb that when you see a child that have undescended testes, you need to go to hospital so the doctor is going to anchor that testes. Okay? You know how ships, they have this anchor that they throw to hold the ship so that the ship will be at a steady place when it has gone to the shore, right? That is the same thing that the doctor does. The doctor is going to anchor that testis. What it is that the doctor is going to try to bring the testis back to that scrotum where it rightly belongs and anchor it. Okay, when you anchor it, the testis is going to now be in that scrotal area, because the testis prefers a cold environment. You male guys on my comment section, don't be shy. When you touch your, the bag of your scrotum, what color is it? What temperature is it? Is it cold or warm? Comment on the comment section. I want to hear you guys. Be very, very sincere. Billini Wilson. This Wilson should be a man. Kick what? You should be a man too, right? So the male in this life, there are so many of you, I can't even continue calling. You are so many here. When you touch your bola, that bag that is on that your bola, is it warm or cold? It's cold, isn't it? Of course, it is cold. The people on Instagram the people on YouTube have answered it. You guys, why are you shy? I am a doctor. I am trying to educate you guys here. So that is what happens when a testis is in that sac. That cold temperature that the sac have is what keep this testis alive. So for babies that have undescended testes and their testes are seen in the abdominal area, if you don't descend it and put it in the scrotal area, the temperature up there is going to make that testes to kind of, will I call it calcification now? Shrink. It's not going to grow the normal way that the testis is meant to grow. So that is what happened to this young man. And eventually, by the time he came to us, they were busy going to the gods of the land. You see, that's why I keep on telling you, whenever you go to all these herbal people, be careful. They don't know anything. Don't use your body as guinea pig. How can they be telling them that it is a mistake or some bad thing that their ancestors did and they were collecting money from them, that they are going to change the sex of them? They're going to change it without surgery. Okay, so by the time we got this boy, the testes had already calcified, so there's nothing that we can do. So this particular kind of boy now is definitely going to be raised as, unless they start giving him injections, estrogens, for him to be feminized, and then they give him a breast. Even male here abroad, they do their breast, they do even construct, remove their penile organ and construct it to be female. Okay, here. So such people thrive well abroad, because abroad nobody cares, nobody look at you, nobody cares. Unlike Nigeria, that the victimization and the environment is going to be hostile to you. You will end up, if not most times, all of them get withdrawn, have mental issues. Some of them might even buy themselves. Okay, so for this particular boy that we met, the best option is either is like he's an Enoch. Okay, like people that have actually grown up and then decide to just go and do a kind of surgery and become sterile. They will never be able to meet any woman any time in their life, and that's what it is. But for him, he could actually start taking injections and feminize himself, and be the female that the parents want him to be. Because if he becomes a male, number one, there's no how he will be able to impregnate a woman, because the testes were not salvaged on time. So there will not be any formation of sperm. Okay, so for Queen Bola, I pity her. How I wish people are going to hear her cry, because she said what she wants to do is if she is able to raise a lot of money, she will relocate out of Nigeria and have a good life where she's going to, because she is physically a female. She has breasts, she looks beautiful. She is a female physically, but in her reproductive organs, she has the male and female reproductive organs that are both functioning. We don't even know whether her, because I'm sure because she came from a poor home, they might not have even done extensive investigations to know whether she will be able to carry a baby as a female. I don't know whether she will, but what we already know is that she has fathered 2 babies. Okay, so for this baby that she had fathered now, number one, they have to do this definitive surgery as young as she is, by identifying to see the sexual character, the sexual reproductive organ that is better for her. Like if they do all the scan, MRI, CT scan, and X-ray and ultrasound, they'll be able to see whether she have fallopian tubes, does she have eggs, does she also, is she able to carry baby. They could actually gently remove the male. It's an extensive surgery that they have to do for that baby, and they will remove the male reproductive organ and keep her, and help her, and she, with love from the family, especially what the trauma the father, this Quimbola, has suffered. She wouldn't want her child to suffer what she has suffered. So the surgery that they're going to do, the both parents, that is the girl that gave birth to her and Quimbola, is going to be involved to make that decision and say, okay, let's make our baby a baby girl and raise her as a baby girl. And what that means is that that baby needs to get out of that environment that she is. So what it is that Quimbola needs to be helped in such a way that she could relocate out of Nigeria, so that that baby can be taken care of and the surgical procedures be carried out, and this baby will be raised. In fact, they shouldn't even let the baby know what happened. Unless maybe when she now grow as a full-fledged girl or as a full-fledged boy, with everything intact, they can now tell the baby and say, see, this is how you are born, but we made this decision and this is who you are today. Okay? So when you blame that person that say he is a transgender or whatever, there are actually people that are hermaphrodites. There are actually people that have that issue that they are going through, that if it has been corrected from ab initio, they will either be assigned that female or the male characteristics, and they grow as a female or a male. Okay, now let us look at the classes. Okay, the class 1 of this hermaphroditism is where somebody have normal female genitalia. Okay, that is the class 1. Now class 2 is when the person have enlarged clitoris. Okay, and then the next class is when the person have partially fused labioscrotal folds. That means the labia majora is folding with the scrotum. So probably that is what happened in this one that we saw in Nigeria. The person had something that looked like a um a a, a labia majora. So they just sent that girl to say, oh, you are a female. But genetically, he is a male. Okay? And by the time they were raising him, the testes, like I said, calcified and became shrunken. So they have already made him to be a female, because yes, he has the body of a male. Like I said, the only thing that that person will be is just an eunuch. He won't be able to impregnate a woman. He won't be able to use his sexual organ because the sexual organ didn't grow. Okay? All right. So the next one is the class 4, where there is fused labioscrotal folds. Remember, the class 4, the class 3 is the labioscrotal fold is partially folded. But in class 4 now, the labioscrotal fold is completely folded. And then the class 5 is where you have hypoplastic scrotum. Okay, the perineal and scrotal hypoplasias or hypospadias are all same. Okay, now class 6 is where you now have normal male genital. All right, so these are the classes of what you see in homophroditism. Okay, so what is that particular treatment that you will give to this person? This is what they would have given to Queen Bola when she was young. Number one, it must be a multidisciplinary approach. That is what you're going to use in treating this child. What it means is that it's not only one type of doctor that will treat this person. It has to be with doctors. It has to be with psychologists. It has to be with mental, psychiatric doctors too. Because guess what? This child have a lot of issues going on with her. So you need a lot of people to be on the team to help. So in that team, you are going to have a pediatric specialist. That pediatric specialist is going to be a specialist in endocrinology and a surgeon. Okay, and you will then have a psychiatrist. This psychiatrist is going to be a pediatric psychiatrist that will be able to know how to interact with this child. Okay, so that psychologically, mentally, and everything, they will be able to help this child to take him to that level where he is going to be, to understand that, oh, you know what, I am still wonderfully and fearfully made. So I don't need to give up. I don't need to think about committing suicide. I don't need to think about buying myself or doing any other harmful things to myself. Okay? Now, the next thing that you need for this baby and the family, yes, the parents of this person, is educational program. This will promote tolerance to the society and to the family. So what it means is that the entire individuals around this baby, around this family, need to be educated so that they don't cause more problem by torturing this child and making the person feel very withdrawn, and at the end of the day, the person will want to buy him or herself. Okay, so the factors that you consider as a doctor and as the family members to make a definitive decision of gender reassignment. No, not this is not reassignment. You're not reassigning anything. You are now assigning a gender to this particular person. Already the person have the gender. That means the female gonads and the male gonad, right? Or also have all the characteristics of the male genitals, the penis, the scrotum, the seminal vesicle, all of that. Okay. Whereas as the female, she has labia majora, labia minora, clitoris, vagina, and sometimes they have the womb and the fallopian tube and the ovaries. So you need to put everything in perspective. Number one, the genital appearance. How is this genital of this person? Is the female one better off, well developed than that of the male part of the female and genital or male genital part? If the male genital is somehow reduced or small, the best bet is to assign the person the female genital so that the person will be a female. But if the person have a full molar and the person's body physics is that of a male, yes, you have to remove the vagina area, remove the everything female reproductive organ, so that this person will not be assigned the male reproductive organ and be a male. All right. The next one is surgical operations that are going to be done. Now, if this surgery is going to be an extensive thing that is going to, cause a lot of damage, you may likely decide not to do any gender assignment surgery for this person. All you need to do is psychologically be there for this person. She must have psychologists and psychiatric doctors around them at all times that is going to be talking to them and making them understand that, look, you are a special being. There's nothing bad in whoever you are, and make the environment to accept them. Okay. Now, if this you look at this female genital or male genital part of this baby and you find out that, oh, you know what, this particular person can be fertile and have babies as if male, like in Queen Bola. She is physically a female, but she is able to have babies. Okay, so why she is a little girl, they would have removed everything about the female part of her genitals, and they will concentrate and make sure that the male part is the one that they were assigned to her. When she get to puberty, because the male genital organ has been repositioned, and probably they were going to give him some testosterone and all the hormones that he need, he would have developed and become masculine. Okay, so it is all these things that the doctor consider before they make decision to give you a certain genital sex. Okay, now they also consider if there would be any reason why, let's say, the scrotal, the scrotum, right? The testicles inside the scrotum that did not grow very well. They may take some samples there, or they will be able to figure out to know whether this particular person, could there be gonadal malignancy? What that means is, could there be any malignancy? Could there be any cancer of any sort that could come through this person? Or they will sample the female part of that person, the egg and all that, and they will do that test. They will be able to find out, oh, this person is at risk of having cancer. So the person is, let us just kukuma remove that particular female reproductive organ, or remove that particular male reproductive organ, so that we can make this person full female or full male, because we think that if he becomes a male, he may end up having cancer of whatever thing it is, either cancer of the testis or that cancer of the prostate or all that kind of things. Okay, now another thing that you need to also think about is if there is a perception of the person and the parents wishing to have a female. Let's say this child is having a male and female gonads, right? And the parents on their own, they already have, just like the one that we saw in lawsuit, right? They had all boys and they want to have a female. So for those, I'm not talking about for his own particular classic case, he was a male that was, ignored. They didn't understand what they should do. So, they grew her up as a female. But when the time for puberty came, he became the male that God made him to be. But in this one, we are talking about real hermaphrodites. Okay, if the hermaphrodites, you look at the hermaphrodite and the parents are saying, oh, I have 4 boys, so I want a female. In that way, this is a child. You people can say, okay, since the parents have females, we can actually remove the female part of him and make him a male. Oh, the parents will tell you that we have all males. We are looking for, we have all females. We're looking for a male. You can remove the female part, remove the male part. It depends on what the parents want. Okay, and the doctor and the team are going to help them, because it is better to give this child just one part of the gonads, right? Either the male or the female gonad, than a child growing up to be castigated, to be dehumanized, to be insulted, and to be, cajoled at all times. And then the person will now start having medical problems every days of her life. Okay, so now another thing you consider before you do the gender assignment is, do you have the right medical treatment to give to this patient? Number one, is the medical facility able to do this surgery and not now put the person into problem? Or you now go there and bastardize everything. You didn't even give him a female reproductive organ, you didn't give him a male reproductive organ. Okay, so you must also consider where this person is. If the person is in Africa or in any place where there is no good facility to do the gender assignment, by removing one of the gonads that is not needed and kept to have one gonad, you shouldn't do that surgery, because you're now going to risk the person from having a bad surgery that will make the person not to have any gender anymore. Okay, all right. So before you do any treatments, talk to this family, consider this child, her future, and everything that could happen to her. Listen, you might not understand what this queen molar had passed through. I respect her for her resilience. I respect her for her um, comeback, and even bringing herself to the internet for people to see that, yes, we have heard about Hemophrodite, but here I am. Yes, I am that Hemophrodite. You see, so we really need to give her the accolades she needs and also support her in any way. If actually you want to support her, I encourage all my fans on Facebook, on Instagram, on Twitter, on TikTok, on YouTube, everywhere around the world. If she puts out a bank account for people to donate to her, that's your one kobo, 1 naira, 2 naira will go a long way to help her, especially now that she has a child that is also having hemophroditism. Okay, we cannot allow her child, this new child, to face what this young lady has faced. She is resilient, I can tell you, and she is wonderfully and fearfully made. All right, so we are going to stop here. I hope you learned something today. It has come to our favorite and most special part of my talk show. Every time it comes to this part, I get so excited because you know what? Somebody is going home with some money. You heard me right here. You know, I am supposed to be making money from giving you this awareness, but in my own decision as a doctor, I decided to say, you know what? For those that paid very, very good attention during the time I'm doing my presentation, I am going to give them the opportunity to gain something. And what is that thing? I am going to give you a giveaway if you answer this trivia questions that I'm going to. So you have to tap it on the comment section and give me the answers. Are you ready? Are you all ready right now? Okay, so we are going to the answer and question side. So are you ready? Okay, good. So my question today is number one. What topic did we discuss? See, you all would think I'm going to give you very hard questions. No, I don't give too much bad questions. I'm going to give you questions that are very, very, very simple so that you'll be able to win my giveaway. So if you answer that question, you are going to be one of the fastest fingers. So you better be fast before another person is going to be the person that is going to win this beautiful giveaway that I'm going to give today. So, what is the topic I talked about? That's number one. Number two, because you have to get all the questions I'm going to give you. Number two is, what are you going to do if you find that a child have two gonads, male and female? Do you just leave that child and say, okay, no, you know what, we are not going to do anything? Or are you going to decide? If you're going to decide on something, what is that thing that you're going to decide? So you type it on the comment section. And my number three question is, what are the chromosomal abnormalities? There's something I told you. I told you that there is 46 something something, 46 something something, 47 something something, and 46 something something, and 46 something something too. I'm sure you got what I'm saying. So tell me all those, give me the different uh, uh, one of them. The first one is 46. I'm going to give you a clue. The first one is 46XX. Okay? So what is the second one? What is the third one? What is the fourth one? And what is the fifth one? So give me the answers. If you don't know the answer, don't be afraid. I am here for you. And I promise you, you are going to get my giveaway. My next answer is this. What sort of team? What are the team that are going to be taking care of this particular person that have both male and female gonad? Number one, I'm going to give you a clue. The person have to be the person taking care of children, but it has to be that the person have knowledge of something that starts with E, okay, and other teams. Just name them. All the teams that are supposed to do the treatment on this baby. When you answer it, my team is already at the back channel trying to find out who got all these questions. If you get all these questions, what we are going to do is you will send me a back channel on my Instagram messenger, okay? Send me a back channel, send me a message and say done. When you send me that message done and we confirm, we come back to this video and see that you answered these whole questions, I will make sure you send your answer. When you send it, I will credit you and I am going to paste the confirmation that I gave you that money. And when you get that money, please, it is very, very important. In the next live that we are going to do, I am going to bring you up and you show proof that yes, you got that money. Is that okay? All right. That's the end of our discussion today. But before I go, my doctor's orders today, because that is another part that I like. My doctor's orders today is when you have this baby, ensure you have your baby in the hospital, but peradventure you don't have your baby in the hospital, please ensure that the person that delivered that baby examine the genital of that baby so that you'll be able to categorically say, yes, this is a female, yes, this is a male, or this is a hemophrodite, so that you start on time to get the treatment that this person desires. Okay? And if you are not sure, there's a confusion, you're saying, this may be Ebola, this may be Becus. All you need to do is take this child to a doctor, qualified medical doctor. Let the person examine very properly and give you the right sex of this person. If any person delivers a baby, please, guys, it is not child abuse in this way. Try and when you're bathing your baby, please, if it is a mother, I think the best thing is to let your husband do that examination, because it's, for me, it is gory to see a woman touching the genital area of her son. Call your husband, tell your husband, please, can you touch the scrotal area? Are you feeling anything? Are you feeling something that is looking like ball that is moving about? That is the testicles, the testis. If you did not see it, you must head to the hospital so that they will find out whether there is an undescended testis, so that they will anchor it. You know why you're anchoring it at that time? So that your baby will grow to be a full-fledged man. You don't have to start suffering these children and then they grow up and they hear that, oh, my test is calcified, I won't be able to have a baby all the rest of my life, and this baby will blame you forever and ever. Okay? Now, the last talk of this show is you. Yes, you watching me on YouTube and on Instagram. Be empathic. Show empathy. Don't allow that word you are going to use on a child to be the thing that is going to bring this person down. Talk to yourself. Anything you cannot allow another person to do to you, don't do it to another person. Okay? Show love and bring everybody together so that we will have a saner environment where we live. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. I am so happy that you all paid attention. And for those that have answered my questions, don't worry, I'm seeing you. But remember, you are going to give me the answer to all these questions. So go ahead, be your fastest finger and give me all the answers. And definitely you are going to see your answer paid into the account that you're going to give me. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Thank you for listening. Ciao, ciao. See you soon. Bye-bye.